That urgent care copay? The one you just paid $50 for? You could have paid $0 for the exact same diagnosis just by staying on your couch. It is not a trick. It is not a loophole. It is a permanent change in how insurance works, and most people have no idea it exists. By the end of this video, you will know exactly how to use telehealth to skip copays entirely. I will show you which insurance plans already offer $0 virtual visits, how to use your HSA to turn a copay into a tax-free expense, and why the UK and Canada are playing a completely different game. You will learn the 3 questions to ask your insurance company right now to unlock free virtual care. And I will give you a step-by-step plan to never pay another copay for a routine sick visit again. Let us start saving you money, starting with your very next sore throat. Let me start with the most important fact. In 2026, a growing number of health insurance plans are offering $0 copays for telehealth visits. This is not a pandemic-era temporary waiver. This is a permanent shift. Starting January 1, 2026, all Aetna plans offer a $0 copay for Teladoc virtual primary care visits, regardless of the reason for your visit. That applies to both employer plans and Aetna Medicare Advantage plans. Blue Cross Blue Shield of Rhode Island has also implemented a $0 cost share for all telemedicine visits in their Medicare plans. United Healthcare has adopted a $0 out-of-pocket expense for virtual visits for eligible members enrolled in applicable fully insured employer-sponsored plans. That last part is the key. You have to be eligible. Your specific plan matters, but the trend is unmistakable. Major insurers are waiving copays and deductibles for telehealth because it saves them money. A virtual visit costs them far less than an in-person visit. They are passing those savings on to you, and many plans waiving the cost share entirely. But what if your plan is not one of those? You still have powerful tools. Let me break this down into 3 segments. First, how to find $0 telehealth in your existing plan. Second, how to use an HSA to make even a paid copay feel like zero. Third, what the UK and Canada can learn from the US system. Segment 1. The 3 questions that unlock free virtual care. Before your next sniffle, call your insurance company and ask these exact questions. Question 1. Do any of my plan's telehealth benefits have a $0 copay or waived deductible? Question 2. Which telehealth platforms are considered in-network for my plan? Question 3. Are there any restrictions on the types of visits that qualify for $0 coverage? The answers will tell you everything. For example, Blue Cross Blue Shield of Rhode Island has a $0 copay for specialists, outpatient mental health, and outpatient substance abuse telehealth services. Some plans waive the copay only for primary care. Others cover urgent care. Know the rules before you need them. Even if your plan charges a copay for telehealth, that copay is almost always lower than the cost of an in-person visit. Without insurance, a telehealth visit averages $40 to $90 compared to $136 to $176 for an in-person acute care visit. With insurance, many plans cover telehealth at the same copay as an equivalent in-person visit. Some waive it entirely, and compared to the average urgent care visit cost of $150 to $280, telehealth is a massive saving. But here is the pattern interrupt that most people do not know. Telehealth does not just save you money on the visit itself. It can also save you from follow-up costs. A 2026 study published in JAMA found that telemedicine visits were associated with lower total episode charges and fewer subsequent visits within 30 days compared to in-person visits. Telemedicine visits cost an average of $96, while in-person appointments cost $509. The telemedicine group also required fewer follow-up appointments. That means telehealth is not just cheaper for the initial visit. It leads to less overall spending on your healthcare. Segment 2, the HSA loophole that turns a copay into zero. Even if your plan charges a copay for telehealth, you can make that copay effectively zero by using your health savings account. Under new rules effective January 1, 2026, high-deductible health plans are now permitted to cover telehealth services before you meet your deductible, and that coverage does not disqualify you from contributing to an HSA. Previously, the IRS viewed pre-deductible telehealth coverage as potentially disqualifying. That is no longer the case. The One Big, Beautiful Bill made permanent the ability to receive telehealth services while maintaining HSA eligibility. Here is how you use this. If you have an HSA, you can contribute pre-tax dollars and use them tax-free to pay your telehealth copays. If you are in the 22% tax bracket, a $50 copay costs you only $39 in real after-tax terms. If you are in the 24% bracket, it costs you $38. But the real power is in pairing a $0 copay plan with an HSA. You pay nothing for the visit, and you still get to keep and grow your HSA funds for future medical expenses. That is a double win. Segment 3, the UK and Canada difference. For viewers in the UK, the NHS is free at the point of use. You do not pay copays for doctor visits, whether in person or online. The concept of skipping a copay does not apply because there is no copay to skip. However, the NHS is expanding its virtual care offerings. A new online hospital for specialist care is being developed with a planned launch in 2027. The initiative aims to provide optional online access to specialist elective care through the NHS app without the need for a physical hospital site. For routine issues, the NHS website and 111 service already provide free triage and advice. For viewers in Canada, the situation is more complex. In most provinces, a virtual doctor visit is free if it is medically necessary and provided through the public system. In Alberta, a virtual doctor visit is free for valid Alberta healthcare insurance plan holders when the consultation is medically necessary. However, coverage for virtual care varies by province. In areas where virtual telemedicine is not insured, patients can still access private telehealth services for a fee. Starting April 4 in 2026, new rules under the Canada Health Act Services Policy aim to ensure that medically necessary virtual care is covered by provincial health plans. That means more free telehealth for Canadians going forward. For now, always check your provincial health plan's coverage for virtual care. Now, here is your action plan to skip copays entirely. Step 1. Log into your insurance portal or call the number on the back of your card. Ask the 3 questions I gave you. Find out if your plan offers $0 telehealth. Step 2. If your plan does, save the telehealth platform's contact information in your phone. Teledoc, Doctor on Demand, Amwell, or your insurer's proprietary app. When you feel a cold coming on, use the app. Not your car keys. Step 3. If your plan charges a copay, ask if you can use an HSA or FSA to pay it. Those accounts use pre-tax dollars, lowering your effective cost. Step 4. If you are in the UK, use the NHS app or call 111 for free advice before you decide to see a doctor in person. Step 5. If you are in Canada, check your provincial health plan's website for virtual care coverage. In many provinces, it is already free. Let me give you a real-world example of how this plays out. A family of 4 in Ohio has a high-deductible health plan with an HSA. The plan offers $0 copays for telehealth visits through Teledoc. Last winter, 3 family members caught a viral illness. Instead of driving to urgent care and paying a $150 copay for each visit, plus parking and lost time, they used Teledoc. Each virtual visit costs $0. They use the time saved to work from home and care for each other. Total out-of-pocket cost for 3 medical visits, $0. That is the power of knowing your benefits. Let me also address the conditions that are perfect for telehealth. Sore throats, sinus infections, pink eye, urinary tract infections, cold and flu symptoms, rashes, allergies, and medication refills. These are all treatable through a virtual visit. Even mental health counseling is widely available through telehealth, often with $0 copays. Do not wait for a major illness to discover your benefits. Set up your account today. One more hidden trick. Some standalone telehealth services charge a flat monthly fee for unlimited visits. For example, a subscription might cost $20 per month for unlimited virtual primary care. If you have a high deductible plan and you anticipate needing several visits in a year, a subscription could save you more than paying per visit. Compare the costs. Do the math. Let me recap the key takeaways. Number 1. Many major insurers, including Aetna, United Healthcare, and Blue Cross, now offer $0 copays for telehealth visits. Number 2. Even if your plan charges a copay, telehealth visits are significantly cheaper than in-person visits, averaging $40 to $90 compared to $136 to $176 in person. Number 3. The new HSA rules allow you to pay telehealth copays with pre-tax dollars, reducing your effective cost. Number 4. Telehealth visits often lead to fewer follow-up appointments, saving you even more money in the long run. Number 5. In the UK, the NHS provides free virtual care through the NHS app and 111 service. Number 6. In Canada, medically necessary virtual care is covered by provincial health plans in many provinces, with new federal rules expanding coverage in 2026. Number 7. Always check your plan's specific telehealth benefits before you need them. Number 8. The best time to set up your telehealth account is today, not when you are already sick. Here is what I want you to do right now. Pull out your insurance card. Call the customer service number. Ask the 3 questions. Do I have $0 telehealth? Which platform do I use? And are there any restrictions? Write down the answers, then download the recommended app. Create your account. The next time you feel a tickle in your throat,